We were delighted in health sciences at the University of Southampton to achieve our Athena SWAN Bronze Award in April 2013. It was a real sense of achievement. We'd put in a year or more of considerable work to explore where we were in terms of supporting the development of the careers of women in science disciplines within health sciences. It had made us go through a process of looking at ourselves really quite closely. We thought we were a faculty that, being predominantly women, 80% of our staff, our academic staff, are women, and more than 90% of our 3,000 or so student body are women too. We thought that we probably had this fairly well organised. But what we did was look carefully at the data and also survey our staff and hold focus groups with different groups of staff and students. And there are a number of things that emerged from that made us look at ourselves. The first thing was that we discovered something of what we call a leaky pipeline of career progression, given that very strong, large proportion of women. Almost all our students are women, with only a small proportion being male. When we started looking at the postgraduate student body and the postgraduate research body, we realised that the proportions changed at that level to something like 30+% of postgraduate research students being male, which suggested to us that something was happening that meant that perhaps women students were not pursuing their careers beyond the undergraduate level, and therefore were not necessarily enabling themselves to have careers in science, in the health disciplines. So that was interesting. We also explored issues for our staff and again found that there were some issues around whether women were as prepared as men to put themselves forward for promotion, whether women were tending to take on more part-time positions and perhaps less progressing their own careers in a more sort of assertive way, perhaps in terms of early career research, and whether they knew all that was on offer for them. So that was interesting. But we did also celebrate many of the things that we'd done really well. We'd started a fantastic clinical academic careers initiative to identify high-flying students and really encourage them to take on the opportunities for studying at postgraduate level to develop clinical and research careers early on. We've also been looking at our staff achievement and felt that actually it was not as easy for women to put themselves forward, for example, for promotion at the different levels as perhaps men. That led us to do staff surveys, lead focus groups, gather data and really explore the issues as to how we could really actively help that more in future. And we've been working on a whole range of initiatives to do that. We've also developed what's now a recognised nationally and internationally a clinical academic career development programme so that we can identify high-flying students very early on, encourage them to step forward and think about doing a postgraduate research career combined with a clinical career in nursing and the allied health disciplines as early as possible. And that's been going really well and was actually highlighted as a real feature of good practice for our Bronze Award. Having achieved the Bronze Award, we didn't want to stop there. So since then, we've been working really hard to get to the next level, and that's to achieve an Athena SWAN Silver Status Award. We have set out a quite detailed action plan to achieve this, and some of the main features of that are already coming to fruition and going really well. One of the main areas of focus has been to really focus and support people to consider promotion in our academic staff community. We've been providing the opportunity for mentorship for anybody considering going for promotion in future, either at associate professor or at the professor level. And for those people who are actively working towards that, we've almost partnered them through the process, and with the university provided opportunities to rehearse and prepare for things like selection interviews. This has been so successful that we've had our largest number of successful promotions this year than in any previous year in health sciences. The interesting thing is that of those 6 people that have achieved promotion, we've had an equal balance between men and women succeeding. And I think that tells us that this Athena SWAN process is good for everybody, because it's enabled people from all sorts of different backgrounds, but also both men and women, to feel more supported and able to go through this process. So we now really want to build on that, and we're hoping to achieve more professorial promotions in future. We've also been working on the Springboard for Leadership programme, which is a real opportunity for women to have some space to look at their own leadership development. The university has put on this programme, and we had among the largest number of women applicants who wanted to take part in it in the university, so much so that the programme was oversubscribed. So in response to that, in partnership with the Faculty of Medicine, we are now putting on our own programme, and that means that there'll be 15 places for women in health sciences to take part in that. And we're also very excited that one of our renowned professors, Professor Kathy Pope, is preparing herself to become a trainer in the Springboard programme method. So we'll have our own internal facilitator for future programmes, and we can encourage others to do the same. We're also going to ask every member of staff to undertake equality and diversity awareness training, and also for those staff who have a management position in the faculty, we'll be asking them to take a second level of equality and diversity training, so that they're well prepared in their management responsibilities for staff in that area. And I think this will really help in terms of raising awareness about equality and diversity issues amongst all staff. Pursuing the Athena SWAN programme has been such a good thing for us in health sciences. It's really made us look at our culture, look at the way we approach, the way we think about issues around gender, yes, but also how we develop ourselves and develop our working environment for our students and colleagues and staff. It's amazing how the narrative around Athena SWAN has just entered into the way we talk about things. It's part of our everyday meetings, it's part of our away day events. It's just become part of our conversation, which means that we're almost daily reflecting on the way we do things, with the ideal that we'll improve how we promote people's careers, particularly women, in future. I'm really looking forward to us pursuing this beyond silver, perhaps even for a gold level in future, which would be very exacting for us to pursue and try and consider.